Good morning, everyone. Today we will be talking about how can you tell if you have a deviated nasal septum or not. So there are 7 main signs that come when you have a deviated nasal septum. Approximately 80% of the world has a deviated nasal septum, but we only have to worry about those deviated nasal septums where the signs and symptoms are present. So first sign and symptom of a deviated nasal septum is nasal obstruction. Whenever there is a deviated nasal septum, you will see that the patient complains that he is unable to properly breathe in. Second most important function of the nose is to smell. So second important sign would be anosmia. The patient would be unable to smell anything. Third thing, because all the sinuses they drain into the nasal cavity, and if you have a deviated nasal septum, so thirdly, you will also experience sinusitis. Because of a deviated nasal septum, your one drainage pathway for all sinuses is blocked, so you always feel sinusitis. Then you can also experience epistaxis because deviated nasal septum may impinge upon the lateral wall of the nose, which leads to two main symptoms. One being that you might experience epistaxis, and the second being that you might experience headache because arteries and nerves are passing on the lateral wall of the nose. And finally, you might have middle ear infection because the only source of drainage of the middle ear is the eustachian tube, which also opens into your nasal cavity, but because of the DNS, in some cases the nasal cavity is obstructed, so that or drainage is also impacted, so that can lead to ear infection, middle ear infection. Hope you enjoyed this lesson. You can also remember all these signs and symptoms with a very easy mnemonic. Naseem has DNS. N stands for nasal obstruction, A for anosmia, S for sinusitis, E for epistaxis, E for external deformity, M for middle ear infection, and H for headache. Thank you very much, and please do subscribe to the channel. We would be bringing you a lot of more similar good knowledge about medicine as well as of other knowledge as well. Thank you.